Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create nursing educational videos to help students and nursing professionals with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. If that is something that you are interested in, please make sure to subscribe now. Hit the notification bell so that you will be verified every time I upload my videos. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi mga nurses, how are you doing? Wherever you are right now, whatever time zone you're watching me right now, just wish you good morning, good afternoon, and good night just in case I don't get to see you. Isang panibagong video lecture ng nursing test banking video ang ali ko sa inyo for today's day, which is Monday. No, it's gonna be a little bit late, not the normal, time I upload my video, but it's still Monday and this is still happening. Now, like you see on the title and like you see on the screen, this is NCLEX practice exam for medical surgical nursing 1. So this is Aleko. This is all of you guys who are planning to take or preparing for NCLEX. Yes, examination. Now, nursing test banking app. I've done a lot of nursing test banking videos on this channel. If you haven't checked that out, I highly suggest for you to check it and try to answer the questions because that is all for you. I have a lot of nursing test banking videos, including all of my other nursing educational videos. I have tons of them. I'm really trying to build this community and build contents on my channel, create contents on my channel wherein I'll be able to prepare you or to refresh you in regards to the nursing education because like you know, nursing is a little bit like a broad body of knowledge, body of profession or education. There's a lot that is needs and have to be learned when it comes to nursing, and that's what I'm doing on this channel. That's the main purpose. Now, I would just like to announce before I further proceed, because this is going to be long, I won't take too much of your time, that I'm going to be launching my podcast channel sometime this year, before the end of this year or late next year. I'll be launching my very first podcast episode. It's gonna be available hopefully on Spotify or others, music streaming platforms that you have. And I'm just wishing for all of your support. I don't have the title yet. Still, I don't have the title, but I have the vision, and that is to empower people, to raise awareness about mental health, to really talk about awareness, living in the moment, soul, life experiences, and really becoming that highest and truest expression of yourself. O, di ba? Ang taray. Ngayon, hindi ko na patatagalin pa dahil like I said, this is going to be lengthy. And because nursing test banking videos, I'm gonna be giving you questions all throughout this video. So let's proceed. Alright, so let me give you the objectives for our today's discussion. I'm going to be providing and discussing to you board exam type of questions or NCLEX type of questions in this case, and I'm going to provide rationalization for each board exam type or NCLEX type of question. Let me give you the instructions for today's examination. Alright, you will be given 10 board exam type of questions or NCLEX type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each question. The answer is revealed instantly after each question with rationalization. Choose the letter of the correct answer. Good luck, nurses. Now, why this is important? Because I feel like, or not I feel like it, it's more of like there's some questions in the board, there's some questions in NCLEX na nare-recycle. Naiiba lang na itsura, naiiba lang anyo, pero the answer and the point of the question is the same. It's asking you for one thing, which is basically the same. Now, if you can get to familiarize yourselves with the type of questions and how to the type of questions that gonna be you may come across with the board exam or the NCLEX exam, you'll be equipped. And if there's one thing that I want you to take out from this video, it's not how high or low your score is, what's the result of your this today's exam, but it is the rationalization. Because kahit pag ikot-ikutin yung tanong, kahit pagka anong gawin sa'yo ng scenario or ng multiple choice na yan, as long as you know why that is the right answer, you'll be able to get and answer it correctly. Now, let's just say that today is your NCLEX examination and you'll have this last 10 questions in the NCLEX exam. How well you want yourself to perform. You want to get these 10 questions right because you have no idea how much could change. These 10 questions can change the result of the exam. All right, so let's proceed. NCLEX type of question number 1. Following surgery, Mario complains of mild incisional pain while performing deep breathing and coughing exercises. The nurse's best response would be, so post-op, si Mario. Tapos, ang tanong niya, i-dissect natin to. While performing deep breathing exercise and coughing exercises, he complains of pain in the incisional site. What is your response as a nurse? Best response. So all of these are correct, except for one who is the best answer. Is it A, pain will become less each day? Is it B, less is normal reaction? This is a normal reaction after surgery. C, with a pillow, apply pressure against the incision. Or D, I will give you the pain medication the physician ordered. Your 5 seconds starts now. Time is up. What is the answer? Very good, nurses. Letter C. With a pillow, apply pressure against the incision. All right, why? Listen, applying pressure against the incision with a pillow will help lessen the intra-abdominal pressure created by coughing, which causes tension on the incision that leads to pain. Of course, you're going to give pain medication because post-op pain management is really one of the highest priority, but this question asks you for non-pharmacological treatment of pain, and applying pillow and apply pressure against the incision is one of the non-pharmacological treatment. Malinaw ba yon? Malinaw. Proceed na tayo. Board exam topic or NCLEX type of question number 2. The nurse needs to carefully assess the complaint of pain of the elderly because older people. Ito ang tanong. Listen, himayin natin. Pain sa mga elderly. Tinatanong ka, why would you need to assess carefully? That is the question. Is it A, because they are expected to experience chronic pain? B, have a decreased pain threshold? C, experience reduced sensory perception? Or D, have altered level of function? Your 5 seconds starts now. Time is up, nurses. What is the answer? Very good. Letter C, experience reduced sensory perception. Elderly po ang patient mo sa tanong na ito. Bakit yun ang tamang sagot? Listen, degenerative changes occur in the elderly. The response to pain in the elderly may be lessened because of reduced acuity of touch, alterations in neural pathways, and diminished processing of sensory data. Period. Alright, so bago ko basahin yung yung next question, gusto lang kitang i-invite na i-like na itong video na to as early as now, pang palaki, charm, and also, don't forget to follow me on all my other social media accounts. It's Neil Galve. Everything is at Neil Galve except for my TikTok, which is Neil Galve Official. Alright, I also have a Facebook page. Please make sure to follow, share, and like my Facebook page. It's Neil Galve. Alright, eto na tayo. NCLEX type of question number 3. Mary received atropine sulfate as a pre-medication 30 minutes ago and is now complaining of dry mouth, and her PR or pulse rate is higher than before the medication was administered. The nurse's best response. Binigyan ka, ito yung tanong, binigyan ka ng clinical manifestation or clinical presentation ng pasyente mo. Dry mouth and increased elevated pulse rate. Alright, hindi ka binigyan ng numerical value pero sinabi sa'yo na elevated pulse rate. This is 30 minutes before what? Atropine sulfate. Anong best response mo? First of all, titingnan mo, pag ganito yung mga tanong, titingnan mo, may deviation from normal ba yung mga clinical presentation ko after kong in connection to atropine sulfate administration? All right, is it normal side effect or adverse effect? That's how you're gonna approach this question. So let me read you the choices. The patient is having an allergic reaction to the drug. Is it B, the patient needs a higher dose of this drug? Is it C, this is normal side effect of atropine sulfate? Or D, the patient is anxious about upcoming surgery? Your 5 seconds starts now. There you go. Time is up. Time is up. Kung medyo mabilis yung 5 seconds, huwag ka mag-alala. You can pause this video and give yourself like 10 seconds. But the thing about this nursing test banking, the way we approach it is I want you to think quickly. So, because isa sa mga magiging best friend mo ay ang time when it comes to examination. Alright? Kasi may time limit yun, hindi yun only. Okay? So, what is the answer to this question? The answer is very good. Letter C. This is normal side effect of atropine sulfate. Now, atropine sulfate is a vagolytic drug that decreases oropharyngeal secretions and increases the heart rate. Hence, the clinical presentation that was presented on this question is normal post-administration of your atropine sulfate. Malinaw yon? Malinaw. NCLEX type of question number 4. Parang paulit-ulit ako sa board exam. Alright. So, ito yung mga, by the way, ito yung mga dating tanong na lumabas ng, o mga posibleng tanong na maaari mong ma-encounter ngayong NCLEX examination. Excuse me, na pwede mo rin ma-encounter sa other, sa NCLEX or sa PNLE or CBT or whatnot. Okay? So, next question, number 4. Anna's post-operative vital signs are a blood pressure of 80/50 millimeters of mercury, a pulse rate of 140 beats per minute, and respirations of 32 cycles per minute. Suspecting shock, which of the following orders would the nurse question? Meaning, alin ang mali? Alin ang tatanungin mo? O i-verify mo na order kapag ganito ang clinical presentation ng pasyente mong post-op, ang vital signs ng pasyente mong post-op. Is it A, put the client in modified Trendelenburg's position? Is it B, administer oxygen at 100%? Is it C, monitor urine output every hour? Or D, administer Demerol 50 mg IMQ 4 hours. Your 5 seconds starts now. Time is up, you guys. What is your answer? Very good. Letter D. Administer Demerol 50 mg IMQ 4 hours. Why? Why is this the thing that you need to question when your doctor orders it? This actually is a wrong, not wrong, the right answer, but a wrong response to the situation. Administer Demerol, which is a narcotic analgesic, can depress respiratory and cardiac function and does not given to a patient in shock. Remember, tinatanong dito ang situation mo, shock. Are you gonna administer something that can depress your RR? This is a narcotic. Everything goes down. Remember? Sa shock, everything goes down. So are you gonna further introduce that harm to your patient? No. What is needed is promotion of adequate oxygenation and perfusion. All the other interventions can be expected to be done by the nurse. Period. NCLEX type of question number 5. Mr. Pablo, diagnosed with bladder cancer, is scheduled for cystectomy with a creation of an ileal conduit in the morning. He is wringing his hands, wringing his hands and pacing the floor when the nurse enters the room. What is the best approach? Medyo anxious ang pasyente mo, tama? Tama. Anong best response mo? That is the question. A. Good evening, Mr. Pablo. What was it pleasant? Madam? Wasn't it a pleasant day today? Or B, Mr. Pablo, you must be so worried. I'll leave you alone with your thoughts. Ang saya. Letter C, Mr. Pablo, you'll wear out of the hospital floors and yourself at this rate. Or D, Mr. Pablo, you appear anxious to me. How are you feeling about tomorrow's surgery? Your 5 seconds starts now. Very psychiatric therapeutic communication. Very good. Time is up. The answer is letter D. Mr. Pablo, you appear anxious to me. How are you feeling about your tomorrow's surgery? That is the best response. Why? The client is showing signs of anxiety reaction to a stressful event. Pre-op, normal lang anxiety. Recognizing the client's anxiety conveys acceptance of his behavior and will allow for verbalization of feelings and concerns. Acceptance of the patient's emotion. You appear anxious to me. You acknowledge. Right? That's acknowledgement. Very therapeutic communication. Next question, number 6. After surgery, Gina returns from the post-anesthesia care unit recovery room, PACU, with a nasogastric tube in place following a gallbladder surgery. She continues to complain of nausea. Which action would the nurse take? May NGT ang pasyente post-op galing sa PACU. Tama. Tapos may active complaint ng nausea. Anong gagawin mo? Is it A, call the physician immediately, B, administer the prescribed antiemetic, or C, check the patency of the nasogastric tube for any obstruction, or D, change the patient's position? Ano kayang indication ng NGT sa pasyente mo? Following gallbladder surgery, pwedeng yon decompression. Tama? So, anong gagawin mo? Your 5 seconds starts now. Time is up, you guys. What is your answer? Very good. Letter C. Check the patency of the nasogastric tube for any obstruction. Assessment. Right? Lahat ng tanong na ito may requires ng nursing intervention. Itong letter C, this one talks about assessment. Natatandaan mo kapag sasagot tayo nursing prioritization of action, we always go with ADPI. Assessment, diagnosis, intervention, implementation, and evaluation, right? Pag hierarchy of questions, ABC plus ADPI, Maslow's. Naalala nyo yun? Naalala. Bigay ko sa inyo yung tama, yung rationalization. Nausea is one of the common complaints of a patient after receiving general anesthesia. But this complaint could be aggravated by gastric distension, especially in a patient who has undergone abdominal surgery. Insertion of the NGT helps relieve the problem. Checking on the patency of the NGT for any obstruction will help the nurse determine the cause of the problem and institute the necessary intervention. Period. Next, number 7. Mr. Perez is in a continuous pain from cancer that has metastasized to the bone. Cancer mets the bone. That's the scenario. Pain medication provides little relief, and he refuses to move. The nurse should plan to. Kapag ang pasyente mo terminally ill with cancer mets the bone at merong pain medication, ayaw gumalaw ng pasyente mo, ano ang gagawin mo? Ano ang nursing planning mo? Is it A, reassure him that the nurses will not hurt him? Is it B, let him perform his own activities of daily living? ADL. C, handle him gently when assisting with required care. D, complete AM care quickly as possible when necessary. Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Letter C, handle him gently when assisting with required care. Now, patients with cancer and bone metastasis experience severe pain, especially when moving. Bone tumors weaken the bone to a point at which normal activities and even position changes can lead to fracture. During nursing care, the patient needs to be supported and handled gently. Next, board exam type or NCLEX type of question number 8. A client returns from the recovery room at 9 a.m. Alert and oriented. Yun yung kanyang level of consciousness. Alert and oriented. with an IV infusing. His pulse is 82, blood pressure 120/80, respirations are 20, and all are within normal range. At 10 a.m. And at 11 a.m., his vital signs are stable. At noon, however, his pulse rate is 94, blood pressure is 116/74, and respirations are 24. What nursing action is most appropriate? Pag mga ganito, huwag ka malilito sa mga number, day. Binibigyan ka ng clinical presentation, i-dissect mo. May time, di ba? O, i-dissect mo. Simula 9 a.m. ang period hanggang noon, 12 noon. Titingnan mo yung vital signs niya. Ilista mo sa likod ng papel. May deviation from normal ba considering na galing sa recovery room pako ang pasyente mo? That's the question. That's how you're gonna approach this one. Is it A, are you gonna notify the physician? Is it B, take his vital signs again in 15 minutes? Or C, take his vital signs again in an hour? Or D, place the patient in shock position? Shock position, baka ikaw i-shock ko. Ito na tayo. 5 seconds starts now. Time is up. What is the answer? Very good. Letter B. Take his vital signs again in 15 minutes. Why? Monitoring a client's vital signs following surgery gives the nurse sound information about the client's condition. Complications can occur during this period as a result of the surgery or the anesthesia or both. Keeping close track of changes in the VS or vital signs and validating them will help the nurse initiate interventions to prevent complications from occurring. All of this clinical presentation and vital signs values that were given to you in this question are all unremarkable, meaning there are normal. So what are you gonna do? Continuous monitoring as your SOP per the hospital. So hospital namin post-op, ginagawa namin monitoring. First 30 minutes, 30 minutes, first 30 minutes upon receiving from PACU, another 30 minutes from the first vital signs, and then 1 hour, 30, 30, 1, 1. Again, it depends on your SOP, on your protocol. Per hospital, may kanya-kanya yan. Pero, my point is, this question, the clinical presentation, and the vital signs that was given to you is all within normal values. There's no reason for you to notify the physician, nor place the patient in shock position because your patient is responding well post-surgery. Period. Alright, nagets yan? Nagets. Next. Question number 9. A 56-year-old construction worker is brought to the hospital unconscious after falling from a 2-story building. Anong case mo? Fall. Tama? 56 years old, construction worker. Okay? When assessing the client, the nurse would be most concerned if the assessment revealed nursing assessment mo sa fall. Saan ka maaalarma? That is the question. Is it A, reactive pupils? Is it B, depressed fontanelle? Is it C, bleeding from ears? Or D, an elevated temperature? Your 5 seconds starts now. Time is up, nurses. What is your answer? Very good. Letter C, bleeding from ears. Bakit? The nurse needs to perform a thorough assessment that could indicate alterations in cerebral function, increased intracranial pressures, fractures, and bleeding. Bleeding from the ears occurs only with basal skull fractures that can easily contribute to increased intracranial pressure and brain herniation. Kasi titingnan mo ako merong halo sign. Naalala mo yung halo sign? Yes, kaya maglalagay ka ng gauze, titingnan ma-assess mo yung bleeding. Yung halo sign, yung yellow spot, that's a CSF leak na makikita mo around the blood. That's your halo sign. Positive ba or negative sa halo sign? Sa mga EMS nurses natin dyan, mga nagre-respond sa mga emergency situation outside the hospital setting, alam na alam nila to. But the answer to this is letter C. Last question na nga tayo, kumusta kayo? Ano yung mga scores nyo? Nangingibabaw ba? Nahihilo na ba kayo? Huwag kayo mag-alala because this is just a practice one for you. I would also like to know your scores. So please, I highly encourage you to put your scores on the comment section because I would like to evaluate the effectivity of this examination, and also I would like to see if how many of you guys are really actually learning and participating for our examination. Okay, no shame, no shame. Pinaghirapan mo yan. Like I said, the main intention, the main goal, main focus of this discussion is for you to grasp the rationalization. Period. Next, NCLEX type of question number 10. Make this one count. This is our last question for today. Which of the following statements by the client to the nurse indicates a risk for factor for CAD? First of all, ano ang CAD? Coronary artery disease. Alin dito, itong tanong, ang high risk for CAD? That's the question. Is it A, I exercise every other day? If that's a patient's statement, is that high risk for CAD? That's how you're gonna approach and attack this question. B, my father died of myasthenia gravis, MG. C, my cholesterol is 180. D, I smoke 1.5 pack of cigarettes per day. Your 5 seconds starts now. I think this one is a pretty easy question. Let's see. Time is up. Did you got this one right? Let's find out. The answer is letter D. I smoke 1.5 pack of cigarettes per day. Why? Makinig. Smoking has been considered as one of the major modifiable risk factors for coronary artery disease, CAD. Exercise and maintaining a normal serum cholesterol levels help in its prevention. Normal value ba ito ng cholesterol? Yes, within normal range. Nag-exercise ang pasyente mo? Yes. Ang myasthenia gravis is not a risk factor, modifiable risk factor for coronary artery disease. Thank you so much, you guys, for watching. I hope you learned something. Let me know if you have other nursing topics that you want us to do. Comment it down below. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have, what's your score? Put it down on the comment section below. Abangan nyo nga po yung next upload natin this coming Wednesday because it's gonna be fun and it's gonna be a lot of, learnings to come, diba? Wednesday and Friday. Tulungan nyo na nga po ako, pamalitan nyo na sa Radyong Sira, ang pinakabago, pinaka-fresh at ang pinaka-libreng nursing review center sa balat ng YouTube. And I would like to, hindi ka pa nagsasubscribe, invite you to please join the community. Like, share, and subscribe to my channel for more nursing educational videos. Follow me on all my other social media accounts. Everything is at Neil Galve, except for my TikTok account, which is Neil Galve Official. Follow me and share my videos on my Facebook page. It's Neil Galve. All the links to my social media accounts and playlist is written on the description box. Check that one out. I'll see you again on Wednesday. You have a good one.